Welcome to this lesson. This presentation was developed by Paulino. This module will teach them data management. Slide 2. These are our learning objectives. We are going to review how to plan a surveillance system. Our objectives are: determine data collection methods, develop data collection instruments, test methods, analyze and interpret data. Slide 3. We are in data management. It is part of data for decision-making cycle. Data management includes data collection, data entry and storage, data cleaning, data analysis and interpretation, organizing and presenting data. Slide 4. Steps for planning a surveillance system are: 1. Establish objectives. It begins identifying high-priority health events. 2. Develop case definitions. Case definitions are the criteria that includes person, place, time, clinical or laboratory diagnosis, epidemiological features. 3. Determine data source or data collection methods. 4. Develop data collection instruments. 5. Test methods. 6. Analyze and interpret data. 7. Disseminate findings and provide feedback. 8. Evaluate. Slide 5. These are criteria for disease selection. Does the disease have a high disease impact? How is the morbidity, disability, or mortality indicators? Does it have a significant epidemic potential? For examples, cholera, meningitis, or measles. Is it a specific target of a national, regional, or international control program by the WHO or other international or regional control programs? Will the information collected lead to significant public health actions such as an immunization campaign, other specific control measures, or international reporting? Slide 6. You can remember different types of major surveillance methods. We can implement mandatory disease notification by healthcare providers. It requires immediate public health response. It is recognizable solely by providers. Reports by laboratories. Immediate public health response may or may not be needed. Laboratory tests needed for recognitions or to meet case definition. Laboratory test adds relevant information, such as salmonella serotypes, antibiotic susceptibilities for TB and pneumococcus, cell type for cancer. They are backup to clinicians' reporting. Sentinel surveillance. It is useful for collecting detailed information on a subset of cases. It has been designed so findings can be generalized to a specified population. It collects limited information to recognize the onset, termination, and characteristics of a particular public health problem of limited duration, such as influenza. Sentinel surveillance is used when incidence of a condition is high, such as diarrheal diseases, acute respiratory infection, RA. Periodic or ongoing prevalence surveys. Prevalence surveys assess prevalence trends over time, such as HIV seroprevalence surveys, BRF surveys. It would be optimal if was designed to be useful to state and local public health agencies. It generates hypotheses regarding risk factors. Its results allows to evaluate the effectiveness of a public health or clinical intervention. Vital records. It is part of surveillance of births and deaths, and trends and causes of death. It is key for infant and maternal mortality surveillance. May be used alone for some analysis. Secondary analysis of data sets collected for other purposes. It places no additional burden on public health surveillance systems. Care must be taken in analysis and interpretation. Immediate public health response are not needed. It assesses the public health impact or monitor trends. Secondary analysis measures morbidity caused due to chronic or recurrent health events. Potential data sources include hospital discharges, billing, insurance, emergency ROMOs, school or work attendance, Immunization registries, worksite injury and law enforcement records. Slide 7. Key topics for data collection. You need to align data with surveillance objectives. At same time, you have to decide type of surveillance, active, passive or sentinel. Slide 8. When you develop data collection instruments, you have to keep in mind following topics, deciding either developing print or electronic survey. You can use some statistical software to allow for tool development. You should also choose between interviewer and self-administered questionnaires. Core characteristics of survey must be brevity and clarity, including especially directions. And not forget testing the instrument. Slide 9. After you apply survey or instrument, you must recognize readability, completeness, and accuracy. Readability is the ease with which a written text can be understood by a reader. Disease reporting completeness refers to the proportion of those diagnosed with a notifiable condition that are reported to the appropriate public health authorities. Disease reporting, if it is representative and consistent over time, need not be complete to successfully monitor demographic, spatial, and temporal trends. Accuracy ensures that findings are considered correct. Accuracy is the extent to which a measurement reflects the true value. It is the tendency of measurement to center around the true value. Slide 10. If you have planned the analysis, you can establish your data entry strategy. Your database or spreadsheet must reflect how you plan to analyze the data. Database is built aligning data entry with survey form. Line item on rows is every observation or registry. Variables go in columns. Each column is each survey question. You have to decide on and document defaults. For example, which will your date format be? American, May 8, 2015 or European, August 5, 2015. Not forget to create data dictionary. Slide 11. You can look registries on rows and variables on columns. Slide 12. A data dictionary is a collection of descriptions of the data objects or items in a data model. It describes variables label, field name, and their operative definitions. For example, field name, DOB variable name, date of birth. Definition /DD/EA. Slide 13. Previous to run analysis plan, we need to clean data. First, we run descriptive statistics in order to recognize missing values, outliers, and mistakes. You can fix discrepancies using survey tools, and revisit defaults, as necessary. Slide 14. When you analyze data, you need to revisit surveillance objectives. You can generate and test hypotheses. Performing descriptive statistics on person, place and time. Exploring other analyses, as necessary. Slide 15. These results correspond to 2002 Guam BRFSS prevalence. You can see increase of obesity prevalence, probably for non-control to previous overweight prevalence. Slide 16. Can this be interpreted as an epidemic occurring in two phases? You can review weeks 19th and 28th. What other information do you need? We need the threshold. Which are the expected cases? We need laboratory confirmation in order to determine etiology. Slide 17. If you compare laboratory-confirmed H1N1 influenza cases, lab reports would indicate it was two different epidemics. We would have an epidemic peak for H1N1. Slide 18. They compare timing of swine flu articles and acute respiratory infections. You can look correlation between articles and RE. Slide 19. You can practice data interpretation. Slide 20. What is your interpretation of this figure? Note, it is a log graph. It uses absolute rates, cases and deaths per 100.000. Slide 21. What is your interpretation of this figure? Note, it is a current graph. Slide 22. It shows case fatality ratio per 100 from 1940 to 1994. Can you interpret it? Slide 23. What do you interpret of this graph? Which are the most affected age groups? Slide 24. How should you present your data? You can use bulletin. These bulletins should easily illustrate trends or changes. It is also important to show, you can show, if the situation is getting better or worse. Slide 25. You need to evaluate a surveillance system. Some recommendations. Describe the public health importance and if goals are being met. Assess quality, validity or repeatability of case definitions, and flow, usefulness, of data. Describe costs or resources needed. Evaluate quality by assessing attributes, flexibility, representativeness, acceptability, timeliness, sensitivity, and simplicity. List conclusions and recommendations, especially on system improvement. For example, improve awareness by increasing education, simplify reporting, or equal feedback. Slide 26. You must keep in mind ethical and legal considerations about public health surveillance. During collection, surveillance systems may be linked, so there is an increasing chance of public disclosure. Keep ethical responsibilities in mind: informed consent, respect for autonomy, beneficence, justice. During reporting is sensitive, responsible, understandable, and timely. You might know your ethical and legal obligations. Ensure the appropriate protocols are in place.